Okay, so now that I hopefully have your attention a little bit, I am going to be talking to you about myasthenia gravis. So what is myasthenia gravis? It is an autoimmune and neuromuscular disease that is characterized by weakness in skeletal muscle tissue, which usually reflects as just overall weakness and fatigue. And it worsens with activity and improves with rest. Right now, there is not a known cure for MG, but it is pretty manageable if the proper measures are taken. So the key symptoms of myasthenia gravis, mostly fatigue, but that is kind of characterized by weakness in muscles in all limbs and the neck, but more specifically the upper extremity, including the hands and the fingers. Drooped eyelids, double or blurred vision is very common because the disease does impact the muscles in the eyes. Impaired speech, difficulty swallowing, and shortness of breath are all also very big symptoms of MG. So what causes myasthenia gravis? There's a couple of things. So error in transmission between nerve and muscle tissue. So as we learned in Kidney 376, acetylcholine binds to receptors on the muscle tissue, and that's where we get the muscle contraction. Well, in MG, the body produces antibodies that block or destroy those receptors for acetylcholine, and so we're not going to get that muscle contraction, and there we have the weakness and fatigue. Also, enlarged thymus. So when we are growing, up until about puberty, our thymus is growing and produces immune cells, and that really just helps our overall immune system. Well, in myasthenia gravis, typically the thymus remains enlarged, whereas normally the thymus would begin to shrink after puberty, but with MG we just continue to have that enlarged thymus, and we do not get the immune cell production, and the immune system will begin to attack itself. So here I'm going to show you a video of the pathophysiology of the disease. I just think this video does a really great job explaining it with some illustrations that really kind of simplify what exactly is going on.
But what happens in myasthenia gravis, though? Well, remember that it's an autoimmune disease, and specifically one that's categorized as a type 2 hypersensitivity, which causes cytotoxic injury, meaning that it results in the lysis or death of host cells, which is mediated by autoantibodies, which are antibodies that are specific for our own cells or proteins. Alright, so in this case, the patient's B cells inappropriately make antibodies that bind to nicotinic acetylcholine receptors on the muscle cells. Once acetylcholine receptors are bound by the antibody, they're unable to bind the acetylcholine, and therefore they don't respond to the contract signal from the central nervous system.
So getting diagnosed with MG, there's usually a couple things that will happen. There will be a physical or a neurological examination where a doctor will look at your previous medical history, check your muscle strength and your muscle tone, check for impairment of any sort of eye movements and functions. Then there's typically also a blood test, which will check for the elevated antibody levels in the blood, and then also diagnostic imaging, thymus abnormalities. If there is an enlarged thymus, that will be used to detect that. Prevalence. So typically we see males are at greater risk than females. About 14 to 40 per 100,000 Americans have MG. But even though men are at greater risk, we still do see it in women, typically women under the age of 40 and men over the age of 60. All racial and ethnic groups are susceptible, it is not inherited, and it is not contagious. And as I said, there is not a cure. So there aren't any known risk factors for myasthenia gravis, but there are some commonly associated diseases. Among the most common is thyroid disease. Rheumatoid arthritis I found was common a little bit, not as much. And then systemic lupus I kind of wanted to highlight just because that is also an autoimmune disease. So I just found it kind of interesting that other autoimmune diseases were accompanying myasthenia gravis. So as I said, there is not a cure for myasthenia gravis, but with proper measurements it is pretty manageable. So commonly we will see medication prescribed to suppress abnormal antibody production. Thymectomy has also shown some promising results for managing the symptoms. And then PT and OT therapy. So there are some precautions you can take if you do have the disease. So medicines to strengthen bones are really important just to kind of maintain that bone strength and integrity, since we have to kind of compensate for muscle weakness. Proper nutrition and exercise is extremely important just to kind of maintain the muscle mass that you have, since due to the lack of contraction and just overall fatigue, it's really hard to kind of build on that strength. That's why it's really important to exercise. So just really easy exercises such as like using resistance bands are really good just because it's low impact. It doesn't take too much out of you. Also these little dumbbells, I just thought I would kind of point these out because I was thinking about it, and exercises could even be like performed sitting down, since fatigue is such a big issue that people with myasthenia gravis have to work with, that you can do, you know, just basic arm exercises while sitting in the chair, and that just kind of takes some of the fatigue component out of the equation, and it's a little bit safer too. So along with that, we do have balancing periods of exertion and rest, just making sure you're kind of structuring your day, taking into consideration that you might need to take more frequent breaks than you would think, and then also just some stress reduction techniques as well. So what can OTs do? The most interesting study I found was this fatigue management course study. So OTs worked with about 50 individuals in this particular study that were diagnosed with a chronic illness that was accompanied by moderate to severe fatigue. So they worked through a fatigue management course with these individuals. So before the actual instruction began, the participants in the study were given 3 preliminary assessments. This first one tested the ability of the individual to perform their basic, everyday tasks, functions, etc. The second one assessed their current social and mental and emotional health, as well as where they felt that their overall well-being was. And this last one tested, assessed the ability that the individual thought they had to accommodate what they were about to learn into their everyday lives. So once the preliminary assessments were done, the one-on-one 6-week fatigue management course began, where the OTs began working with the individuals on different strategies they could implement into their life just to reduce their fatigue. The sessions lasted 1 to 2 hours for about 4 to 6 weeks, and then after that there was a 6-week no intervention period. After that, there was the follow-up assessments, where they reassessed the initial assessments once again, as well as where the individual was able to incorporate strategies, how often, in what context, and that sort of thing. We are going to do a quick little activity just to kind of give you a better idea of what the fatigue that I'm talking about feels like for these individuals. Okay, so for this activity, what I'm going to have everyone do is just kind of stand up with their arms out in front of them for about 20 seconds. And this should not be very difficult, obviously, for any of us, right? Like, it's not that hard. Just hold our arms out in front of us. We don't feel any sort of fatigue. Our muscles don't feel really tired or anything like that. Like, this is just really easy. But now what I'm going to have you guys do is, and everyone's going to be mad at me, is we're going to do like 10 to 15 push-ups. And then we're going to try that again. So everyone, give me some push-ups. I'm also not sure if anyone could just hear all of my elbows and shoulder joints crack. And don't hate on me for having my knees on the ground either. But after doing some push-ups and then trying to hold your arms out again, instantly, it shouldn't be super difficult, but you should definitely be able to tell a difference in how hard it is just to simply hold your arms up. And what I'm trying to get to is that people with MG, that's what they feel like, just doing, everyday things. Like, so this might not be difficult even after the push-ups, but imagine just having that little bit of fatigue every day when you're trying to brush your hair or brush your teeth or play with your kids or whatever, you might be doing throughout the day. It would definitely be difficult and frustrating, and so that's just kind of what they experience every day. And I just want to thank you guys for watching the presentation, and I look forward to seeing everyone else's. Bye.